Screening centers run by Greater Chennai Corporation play an important role in identification and management of COVID-19 patients in the city. Screening centers are one of the pivotal reasons for less mortality rate in the city. The people who are tested positive for COVID-19 through a swab test come to screening centers where all necessary lab investigations like blood pressure, blood sugar, pulse rate, oxygen saturation level, general blood investigations, and chest x-rays are done, and the preliminary assessment of their current health status is also determined at those centers. This helps in identifying and differentiating the high-risk patients from others with less or moderate symptoms. The people with lesser symptoms are sent for home isolation, or if there is no proper space for home isolation, they are sent to COVID care centers. Those who come under high risk are sent to hospitals for tertiary care and treatment. Since asymptomatic and lesser symptomatic patients are sent for home isolation or COVID care centers, scarcity of hospital beds for sick patients and high-risk patients is being avoided. All of them can be given eminent medical care. All investigations and assessments are done at the screening center level, which avoids the crowding at the hospitals, and with availability of early reports from those centers, respective treatment procedures can be started much earlier. Since high-risk patients are identified early in this process and given proper medical care, their health prognosis becomes better and their survival rate becomes higher. There are 12 screening centers run by Greater Chennai Corporation across all the zones of the city. The COVID-19 positive patients are taken to these centers in an ambulance. All the corporation workers in contact with the patient are provided with masks, gloves for their protection, and the medical personnel testing the patients are provided with PPE kits. Intensive sanitation takes place in all the centers on a periodical basis to prevent the further spread of COVID-19. Due to all these coordinated advantages, mortality rate is continuously maintained at very low levels despite Chennai being a densely populated cosmopolitan city. Screening centers, along with an efficient Chennai model of decentralized management chain, are playing a vital role in curbing the percentage of COVID-19 deaths in the city.